Dr. Baliga here. This podcast is first in a series of podcasts on a blog post written by Bill Gates. It's titled The First Modern Pandemic. It's a verbatim reading from this blog post. Clearly, we physicians are not accustomed to taking insights from college dropouts. But as you all know, Mr. Gates is an outlier and spends a lot of his time doing philanthropy, developing vaccines, and preventing disease worldwide. So his insights are valuable to the physician community. So today I'm going to dedicate this and next few podcasts on his blog post, which is detailed. These blog posts are important because he discusses innovations in testing, treatments, vaccines, and policies to limit the spread of coronavirus while minimizing the damage to economies and well-being of individuals. The coronavirus pandemic has caused damage to health, wealth, and well-being, and has pitted all of humanity against the virus. He says it's like a world war, except in this case, we are all on the same side. And it's really important for all of us to know more about this disease and develop tools to fight it. This blog post or his memo shares views of the whole situation and how we can accelerate these innovations. In my opinion, his insights are important. After all, he emphasized pandemic preparedness in a New England Journal article in 2015 and a TED Talk around the same time, so his insights are valuable. As he says, with the pandemic, the situation changes every day. There's a lot of information available, much of it contradictory, and it can be hard to make sense of all the proposals and ideas you may hear about it. It may appear that we have all the scientific advances required to reopen the economy, but in fact, we do not. So in this podcast, derived from his blog post, it's fairly technical, but he hopes this will make sense of what is happening, understand the innovations which he thinks we will need, and make informed decisions about dealing with the pandemic. Exponential growth and decline. In the first phase of the pandemic, there was an exponential spread in a number of countries, starting with China and then throughout Asia, Europe, and the US. The number of infections were doubling many times every month. If people's behavior had not changed, most of the population would have been infected. By changing behavior, many countries have gotten the infection rate to plateau and start to come down. He says, exponential growth is not intuitive. If you say that 2% of the population is infected and this will double every 8 days, most people won't immediately figure out that in 40 days, the majority of the population will be infected. The big benefit of behavior change is to reduce the infection rate dramatically so that instead of doubling every 8 days, it goes down every 8 days. We can use something called the reproduction rate or the R0, which is written as R0, to calculate how many new infections are caused by an earlier infection. R0 is hard to measure, but we know it's below 1.0 wherever the number of cases is going down, and above 1.0 wherever the number of cases is going up. And what may appear to be a small difference in R0 can lead to very large changes. If every infection goes from causing 2.0 cases to only causing 0.7 infections, then after 40 days, you have 1/6 as many infections instead of 32 times as many. That's 192 times fewer cases. Here's another way to think about it. If you started with 100 infections in a community, after 40 days, you would end up with 17 infections at lower R0 and 3,200 at the higher one. Experts are debating now just how long to keep R0 very low to drive down the number of cases before opening up begins. Exponential decline is even less intuitive. A lot of people will be stunned that in many places we will go from hospitals being overloaded in April to having a lot of empty beds in July. The whiplashing will be confusing, but it's inevitable from the exponential nature of the infection. As we get into the summer, some locations that maintain behavior change, that is social distancing, will experience exponential decline. However, as behavior goes back to normal, some locations will stutter along the persistent clusters of infections, and some will go back into exponential growth. This picture will be more complex than it is today, with a lot of heterogeneity. Have we overreacted? It's reasonable for people to ask whether the behavior change was necessary. Overwhelmingly, the answer is yes. There might be a few areas where the number of cases would never have gotten a large number of infections and deaths, but there was no way to know in advance which areas those would be. The change allowed us to avoid many millions of deaths and extreme overload of hospitals, which would also have increased deaths from other causes. The economic cost that has been paid to reduce the infection rate is unprecedented. The drop in employment is faster than anything we have ever experienced. Entire sectors of the economy are shut down. It is important to realize that this is not just the result of government policies restricting activities. When people hear that an infectious disease is spreading widely, they change their behavior. There was never a choice to have the strong economy of 2019 in 2020. Most people would have chosen not to go to work or restaurants or take trips to avoid getting infected or infecting older people in their household. The government requirements made sure that enough people changed their behavior to get the reproduction rate below 1.0, which is necessary to then have the opportunity to resume some activities. The wealthier countries are seeing reduced infections and starting to think about how to open up. Even as the government relaxes restrictions on behavior, not everyone will immediately resume the activities that are allowed. It will take a lot of good communication so that people understand what the risks are and feel comfortable going back to work or school. This will be a gradual process, with some people immediately doing everything that is allowed and others taking it more slowly. Some employers will take a number of months before they require workers to come back. Some people will want the restriction lifted more rapidly and may choose to break the rules, which will put everyone at risk. Leaders should encourage compliance. Differences among countries. The pandemic has not affected all countries equally. China was where the first infection took place. They were able to use stringent isolation and extensive testing to stop most of the spread. The wealthier countries, which have more people coming in from all over the world, were the next to be affected. The countries that reacted quickly to do lots of testing and isolation avoided large-scale infection. The benefits of early action also meant that these countries didn't have to shut down their economies as much as others. The ability to do testing well explains a lot of variation it is impossible to defeat an enemy that we cannot see. So testing is critical to getting the disease under control and beginning to reopen the economy. So far, developing countries like India and Nigeria account for a small proportion of the reported global infection. One of the priorities for the Bill Gates Foundation has been to help ramp up the testing in these countries so they know their situation. With luck, some factors that we don't understand yet, like how weather might affect the virus's spread, will prevent large-scale infection in these countries. However, our assumption should be that the disease dynamics are the same as in other countries, even though their populations are disproportionately young, which would tend to mean fewer deaths from COVID. This advantage is almost certainly offset by the fact that many low-income people's immune systems are weakened by conditions like malnutrition or HIV, and the less developed a country's economy is, the harder it is to make the behavior changes that reduce the virus's reproduction rate. If one lives in an urban slum and do informal work to earn enough to feed your family every day, you won't find it easy to avoid contact with other people. Also, the health systems in these countries have far less capacity, so even providing oxygen treatment to everyone who needs it will be difficult. Tragically, it is possible that the total deaths in developing countries will be far higher than in developed countries. In the next two podcasts, I will complete the rest of the memo written by Mr. Bill Gates. His memos are important because it gives big picture thinking to us physicians who tend to specialize in our own areas of concentration. This pandemic has made it sure that we all physicians understand public health better than we did in the past.